Good morning everybody. We will be talking about newer advances in meniscus repair and what are the new technologies that we can use about in repairing the meniscus. Next slide. Now meniscus repair is very important because as compared to a meniscal removal or a meniscectomy, if you do a meniscus repair, it will restore the function. It minimizes the load transmission, so it's like a cushioning effect. So meniscus is it will give a cushioning effect. It reduces contact stress. It contributes to stability. There is a chondroprotection phenomenon, and we can repair. So it is our duty, I'll say, that we try to repair as much meniscus as possible. And the indications of meniscus repair is increasing day by day. Now we are able to do more meniscal repairs than we were able to do before. Next slide. Now we should have a very low threshold to try meniscus repair, because a smallest amount of the meniscus tissue, if you are able to preserve, you will be able to increase the functionality and the longevity of the knee to a large extent. Now, as far as the repair is concerned, there are a lot of factors which include the location of tear, the type of tear, etiology of tear, any concomitant injuries, and the patient profile. But by and large, as an evolving or a budding orthopedic surgeon into arthroscopy, you should try to increase the rates of your meniscus repair day by day as you progress in your seniority. Next slide. Now, tears are very good healing in a peripheral zone as compared to central zone. But nowadays we are doing some repairs in red-white zone, sometimes in white-white zone also. They do heal. It is not that a red-white zone or a white-white zone cannot heal. It's not like that. Next slide. Now, earlier red-white zone was a doubtful area, but nowadays we are repairing these zones as well. Next. Now, there are different types of tears. Now, this is a horizontal tear, this is a radial tear, this is a vertical tear, this is a flap, and this is a bucketed tear. So, these are the 5 most common types of tears that you will see in your practice. Now, what will you do? Right. So, what will be your preferred modality in each of them? Can you tell me? So, if you have a horizontal tear, what do you want to do? How do you want to repair it? Horizontal tear. So what we want to do is we want to close this mouth, because if this mouth will remain, it may also cause a cyst formation on the back. So you need to place one anchor up and one anchor down and close it, or one suture up and one suture down. So we want to close the mouth. That is the most common repair in the horizontal tear. Okay. Now this is a difficult tear to repair, radial tear. What will you do? How do you repair this tear?
Side to side.
Exactly. So side to side. So you place one anchor here and one anchor here and try to close it. So it will close. That is one option. Second option is there is a suture which is available, and you can make a loop around it and close it. Okay. So that is with a free number 20 suture. The third option is we are using a meniscotibial implants. So like morning we saw. So meniscus repair, there is a new addition. So theoretically, if you have read about the meniscus repair types, you must have read about inside out, outside in, and all insides. 3 types of meniscus repair. Inside out, you put needles from inside, cast them outside, tie out the capsule. Outside in, you use the spinal needles, repair them. And all inside is you are using some special instruments, some special implants. The fourth horizon to this meniscus repair is a meniscotibial repair. So what we can do is we can put some anchors onto the tibia, and with those threads you can repair the meniscus. So this is called as a meniscotibial meniscal repairs. Now this is a new horizon, and we do these repairs with 2 variations. The first variation is a root fixed anchor variation, which we did in the morning, and in that we put an anchor in a retrograde fashion in the posterior aspect of the root, and with those threads we can repair the meniscus. That is number 1. The second part is the astronaut X anchor, or this is an extrusion repair anchor. So that can be inserted directly into the tibia, and those threads you can do side to side passage and close this like a margin convergence. Okay. So this kind of a radial tear, technically, if it is in the posterior 40%, you can close it or you can use a root fix anchor, and in the anterior 60%, you can use an anti-grade anchor, which is an osteonaut X or an extrusion repair anchor. We'll tell you how to use it. Okay. Now, what is this pattern?
Vertical.
How will you repair it?
All inside.
You can use it all inside, inside out, or outside in, but you need to repair in a vertical fashion. So you one in the capsule and one in the meniscus, and you repair it. That is the vertical tear. Flat tears I will discuss more. This lecture is more about flat tears. And what is this?
Bucket handle.
And how will you repair it?
Multiple
So bucket handle is an